Diabetic retinopathy is an eye-related complication identified in people suffering from diabetes. It's so prevalent that around 93 million adults are affected by it on a global scale. Diabetes triggers diabetic retinopathy, and both type 1 and type 2 patients with diabetes stand a high risk of diabetic retinopathy. A significant percentage of diabetes patients have uncontrolled cholesterol and hypertension that increases the frequency of diabetic retinopathy. Almost everyone having diabetes is vulnerable to the risk of vision impairity and the various eye disorders. Diabetic retinopathy is a burgeoning problem globally. India has over 77 million patients with diabetes, which is the second largest in the world after China. Further, another recent survey highlighted that almost 63% of Indians are not even aware that diabetes has a hazardous effect on their eyes. 92% of patients with diabetes underwent retinal analysis after their vision was affected. Another study of 7,000 diabetes patients in 41 countries pointed that 80% of DR affected face difficulties while doing their daily chores like driving, reading, etc. DR symptoms include blurred or distorted vision, new color blindness or seeing colors as faded, poor night vision, small dark spots or streaks in your vision, trouble reading or seeing faraway objects. The treatment for diabetic retinopathy depends on various factors of the patient like the age, medical history, extent of retinal damage, visual acuity, and HbA1c.
Diabetes-related eye problem can be 100% preventable. They also require regular monitoring, as in early course of the diabetes eye problem, they may not have any symptom. Person with diabetes should get screened for eye problem annually. Eye is one of the important complications of diabetic patients, diabetic retinopathy, but other complications in diabetic patients are equally common, like neuropathy, which is problems of nerves in patients with diabetes. It is kidney problem, which is known as nephropathy, diabetes kidney disease, diabetes heart disease, which 2/3 of our diabetic patients develop it. Diabetic patient may have stroke, they may have heart failure. Now with the availability of fundus camera in diabetes clinic itself, we can screen all our diabetic patients for retinopathy. Annually screen they can be done, and those who have some problem they can be referred to retina specialist doctor, and then retina specialist doctor can be followed up as per their protocol, that whether they need every 3 months or 6 months and what the treatment.
Patients' understanding of the nature and effects of diabetic retinopathy as well as regular eye exams aid in early detection and treatment. So for this, the Network 18's NetraSuraksha, India Against Diabetes initiative in association with Novartis India, one can simply get a self-check done by answering a simple questionnaire. This will help evaluate if one has any worrying signs that call for an eye screening. Log on to www.news18.com/NetraSuraksha to know more.